that's a great summary. 6 indications of PARP inhibitors in recurrent disease, 3 treatment, 3 platinum-sensitive maintenance, 2 indications of bevacizumab, platinum-resistant, platinum-sensitive disease. And although there's only 5 chemotherapy-approved backbones, there's really 6. 3 platinum-sensitive, carbogem, carbo-PLD, carbopaclitaxel, and in resistant disease, liposomal doxorubicin, weekly paclitaxel, topotecan. So lots of flexibility. I think the key message is that they do need these targeted therapies. So let's talk about what's new. Clearly, these patients in recurrent disease are not being cured. We have some single agent studies, some of which were presented here at the Society of Gynecologic Oncology. Katie Moore, tell us about some of these single agent, interesting novel therapies, some of which are antibody drug conjugates.
Sure. So these are all relatively small studies, but I think kind of a glimpse of what's to come in the next few years in terms of larger, potentially randomized studies. So Dr. Deborah Richardson presented on a novel antibody drug conjugate that doesn't really have a name yet. So it's XMT-1536, but this is an antibody drug conjugate that targets a target we've looked at before. It's NaPi, it's called NaPi2b. NaPi is sodium, it's a sodium phosphate transporter. And this has been a target in some other ADCs that actually had a nice signal in the past. This is an interesting target in that it's a lineage marker for ovarian cells. So where you have NaPi2b expression is anything that sort of originated from the ovary or fallopian tube. So it's really overexpressed only on ovarian cancers and not on normal tissues in large part, which is an ideal target for these antibody drug targets, which you can kind of think of as Trojan horses, where they kind of get to the gate by finding that target, they get let into the gate, and then they release this payload of very, very potent cytotoxins, totally dissimilar from any of the normal chemotherapy we would use sort of as free drug. In this case, it's an auristatin chemotherapy. So it's a pretty novel antibody drug conjugate. I won't go too much into the structure of it, but it is very interesting. It has a very high drug antibody ratio, so it really delivers a punch. So they reported on their phase 1 data with 59 patients. 37 of them were patients with epithelial ovarian cancer. They're currently at a very high dose range with no DLTs. And the partial response rate thus far among women who've received kind of a reasonable dose of the drug, you kind of exclude women who are enrolled at dose level 1, is 33%. So this is an interesting signal in very heavily pretreated patients who are in phase 1 centers, and is moving its way, as you know, into larger multi-site phase 2 studies kind of as we speak. So something that folks should be aware of coming down the path for them to have access to. We've definitely had it open here for a while and have seen responses, and so those are encouraging. So that's an antibody drug conjugate.
I'm going to stop you right there because you know, you and I and Tom Herzog were associate directors of the GOG, and these studies with that ADC targeting NaPi2b are open within their GOG. And Sharon Loon has a reputation of being one of the earliest sites to open our studies, and certainly Tom Krivak is a high enrolling center. So don't forget these opportunities in that study and the one you're going to tell us about next, but to operationalize these enrollment situations through the GOG partners mechanism. Go ahead, tell us about the next one.
So the other things that were presented, probably the one that's most likely to move forward kind of falls into the realm of novel ways to target angiogenesis and potentially come at those patients who've seen bevacizumab maybe several times and bevacizumab has stopped working. Can you still target the angiogenesis pathway effectively? So there's a pathway called the Notch pathway. The Notch signaling pathway has 5 ligands. The most critical, or the ones that we're targeting right now, are DLL4, Notch1, and Notch3. And there are 2 kind of related abstracts that were presented at SGO. One run by Rob Coleman and presented by Dr. Handley, looked at a pure Notch inhibitor called demsizumab, which is a DLL4 antibody with weekly paclitaxel in a phase 1b, very standard kind of phase 1 population of recurrent ovarian cancer, and they reported a response rate that was respectable, about 22%. So there, but not overwhelming, and had some of the expected toxicities, which are hypertension and notably pulmonary hypertension. Because when you only target Notch, you kind of lead to this vessel sprouting in the pulmonary vasculature. So that's one of the tricky things about targeting Notch. So if you add in VEGF inhibition, you can decrease that vessel sprouting and hopefully avoid that complication, and hopefully also increase your efficacy. So that's the drug navaciximab. So this was presented by me. So sorry. So it's navaciximab plus, I forgot actually, plus weekly paclitaxel in platinum-resistant ovarian cancer. It was another phase 1B study. And here, about 70% of the patients who enrolled to the study, all of them were epithelial ovarian cancer, had seen prior bevacizumab. So that's unique to this study. And we had an overall response rate of 43%. Again, very heavily pretreated. So this agent is moving into a randomized phase 2 trial. Again, we'll open through the GOG Partners mechanism, and we're pretty excited to see it moving forward.
Yeah, thank you for that. And I was really looking forward to that. And that was very, very concise.